Today we are talking about menopause. While it is a natural part of life, many people don't like to talk about it, but it doesn't have to be a mystery or a struggle. With the right information and support, women can take charge of this chapter with confidence. Tonight we are talking all about menopause, from hot flashes to brain fog, with Dr. Suzanne Miller from Cone Health Center for Women's Healthcare at Drawbridge Parkway. So to start, how does someone know if they are in menopause, and when does it usually start?
So most women know that they're in menopause because their menstrual cycles start to change and then ultimately stop. That time in life is generally between the ages of 45 and 55. It's not considered abnormal unless it starts before age 40. So the official definition is cessation of menstrual cycles for 1 year due to ovarian hypofunction or basically diminished ovarian function.
Gotcha. And what's the difference between perimenopause and menopause?
So perimenopause is that time before. The terminology is confusing sometimes for folks because it all kind of sounds the same. So it can be as short as a few months before actually cycles stop. It can be years. There are women that do really struggle with perimenopausal symptoms for even up to 10 years before they actually go into menopause.
Gotcha. And I must have missed this part. Did you say the specific age group that it usually starts when it comes to menopause and people start feeling those symptoms?
Yes, usually between 45 and 55 is actually when menopause occurs.
Okay.
That the specific average age for women in the United States is 52.
Gotcha. Moving on here, how does surgical menopause differ from the typical menopause transition, and how can women manage the changes if it happens early?
So surgical means removal of the ovaries. So all of a sudden the ovaries are gone and all of a sudden the estrogen's gone. So it's very sudden and it's not as gradual a transition as occurs for women who go through natural menopause. One confusing question or a conversation I sometimes have with patients who are thinking about surgery is that a hysterectomy is not actually removal of the ovaries. So you can have a hysterectomy and still actually keep ovarian function because your ovaries can stay and not be removed at the time of surgery. So that's a little bit confusing for folks, but the surgical menopause is actually when the ovaries are removed. And because it is so sudden, very often when I'm having conversations with my patients about removal of ovaries, we're talking about what we're going to do to manage the symptoms immediately after surgery because they do occur really quickly instead of waiting and seeing what occurs, as is more common the process with menopause when it's not surgical.
How do you know if you are a good candidate for surgery when it comes to menopause?
So ask that question to me in a different way, please.
Yeah, how do you know if surgery is an option that you might need to undergo? Is there something that might occur where it's a doctor might say, hey, let's make sure you go through the surgery process. How do you
Right.
know?
So for removal of ovaries, since we're talking about menopause, the most common reason for removal of ovaries would be usually from pain issues, and endometriosis, or someone has an increased risk of ovarian cancer discovered through genetic screening. So now when we do hysterectomies for bleeding, we very much or very often leave ovaries because that helps to it helps to benefit, it helps with cardiovascular benefit later in life. So generally ovary removal has to do with pain, endometriosis, and then genetic risk for ovarian cancer.
Gotcha. And there are a lot of symptoms: hot flashes, sleep issues, mood changes, or just to name a few. But what are the most common symptoms?
The most common symptom is hot flashes. Outside of that, conversations just today with patients, decreased libido, vaginal dryness, which sometimes can impact intercourse, so pain with intercourse, sleep disturbance from hot flashes at night. We sometimes will talk about mood swings, mood changes that occur in menopause. It is really a broad spectrum of symptoms.
How can you manage the symptoms?
There's a lot of options, from non-hormonal herbal remedies to prescriptions. I think a lot of times the conversation goes straight to estrogen and hormone replacement therapy, which absolutely has a role in management of menopausal symptoms. But there are other non-hormonal medications that we can use, and even herbal therapies. I have some patients who've done acupuncture, and so a little bit less traditional treatments for hot flashes, and other menopausal symptoms. I think the thing that's really difficult is that it's not a sort of a one thing fixes everything for all women. So you really have to think about the spectrum of symptoms and what are the symptoms that we're really trying to address. So, for example, we would talk about, or I would talk about, the mood swing issues and mood changes differently than I might someone who's really having a lot of issues with night sweats and sleep disturbance.
Mm.
So it's not just a one thing does it for every single person.
How can diet and exercise help with some relief?
Definitely exercise, because it actually help the some of the symptoms, including hot flashes, and can help with night sweats. Women who have a lower body fat content tend to actually deal with menopausal symptoms better, so they have less issues with hot flashes. Certainly, lower sugar diet helping to prevent diabetes, maintaining normal body weight, lower fat diets can all help with some of the other symptoms that we see around the time of menopause.
And studies show that some women deal with brain fog and shifts in mood during menopause. What causes this specifically?
Yeah, specifically, it comes from the rapid change of hormones, and the influence that that has on something in the brain we call neurotransmitters. Neurotransmitters are the chemicals that go between the neurons in the brain, and that is affected by the hormonal changes, and that's what causes the brain fog that women experience around the time of menopause.
How can they manage that better when it comes to their focus and then mental health?
It's a good question, and it's not always an easy answer, because estrogens really help, but estrogens are not always the right answer for every woman. So those things that also help with mental acuity, working word games, reading, keeping your brain really active. But sometimes women need to also create new structures that help them with memory. I'll give a personal example. I keep a calendar and I keep lists for everything now in a way that I didn't used to, because I've found that my memory's not quite as sharp as it used to be. So sometimes it also, you need to develop some other structures, not just medications that'll help with your memory.
Absolutely. What about hormone therapy, and what should we know about it?
So this is probably the most common conversation I have around menopause with women. The most common question is estrogen going to help me, and what are the risks? So there was a pretty large study back about 20 years ago called the Women's Health Initiative. We would call it a landmark study. And a lot of women stopped hormones back 20 years ago, because of that study. There were some concerns about risks with heart disease and both breast cancer. So in that time since the Women's Health Initiative, the studies continued. We've had continued updates from that study. And some of the things 20 years ago are not quite as significant as they were thought at that time. So women who have a uterus need to use estrogen and progesterone. Women who've had a hysterectomy can use estrogen alone. There are a little bit more risks with estrogen and progesterone together, probably because there's two hormones. The hormone replacement therapy that's commonly used, it does really help with almost all the symptoms of menopause, but we do need to be aware of specific risks, which can be cardiovascular disease, stroke, clot formation, and also breast cancer. So estrogen is not the answer for every single woman.
We have about 1 minute left, but that goes into my next question. Like, is it recommended for everyone?
Yeah, it is not. So if I had somebody who already had cardiovascular disease, for example, maybe had a stent that had been placed to help keep the vessels in the heart open, someone who'd already had a stroke, someone who'd had a blood clot in the lung called a pulmonary emboli, they are not good candidates for estrogen.
Gotcha. Well, thank you so much for being with us today. We have about 20 seconds. Anything else that you'd like to add?
I think that the most important thing to remember about menopause is that it is a spectrum of symptoms, and that women are on all along the spectrum. There are lots of things that we can do to help with menopausal symptoms, and don't hesitate to talk to your doctor. And Dr. Google did not go to med school.
That is right. Well, thank you so much. Well, again, if you did, I just lost my train of thought because that caught me off guard. Dr. Google, I've never really heard of that before, but missed this entire conversation. You can find it on WFMYnews2.com.